we would feel much better knowing that we can sustain this pace if we could start to offload patients to these two facilities. In any event, plateau, not plateau, we still have to extend New York pause, because if that curve is turning, it's turning because the rate of infection is going down. One of the reasons the rate of infection is going down is because social distancing is working. We have to continue the social distancing. Schools and non-essential businesses will stay closed until April 29th. I know that's a negative for many, many reasons. I know what it does to the economy. But as I said from day one, I'm not going to choose between public health and economic activity, because in either event, public health still demands that we stay on pause with businesses closed and schools closed. Whether we've hit the apex or whether we haven't hit the apex, you'd have to do the same thing. There's also a real danger in getting overconfident too quickly. This is an enemy that we have underestimated from day one, and we have paid the price dearly. Well, the numbers look like they may be turning. Yay, it's over. No, it's not. And other places have made that mistake. Hong Kong has made that mistake. South Korea has made that mistake. And we're not going to make that mistake. The weather is turning. People have been locked up. We've been talking about cabin fever. Now it's a nice day. I'm going to get out. I'm going to go take a walk. Now is not the time to do that. And frankly, there has been a laxness on social distancing, especially over this past weekend, that is just wholly unacceptable. Look, people are dying. People in the healthcare system are exposing themselves every day to tremendous risk walking into those emergency rooms. And then they have to go home to their family and wonder if they caught the virus and they're bringing it home to their family. If I can't convince you to show discipline for yourself, then show discipline for other people. If you get infected, you infect someone else, you go to an emergency room, you put a burden on all sorts of other people who you don't know and who, frankly, you don't have the right to burden with your irresponsibility. And people, especially in New York City, the level of activity is up. Partially the weather made it a nice day. I understand people have been locked up for a long time, but now is not the time to be lax. And it is a mistake. We all have a responsibility. We all have a role in this. We said that from day one. And we have to respect the role that we play. Because the role that we play is a societal obligation. That's how I see it. I want local governments to enforce the social distancing rules. The local governments are charged with enforcement. I want them to enforce them. And I want to be, frankly, more aggressive on the enforcement, because all the anecdotal evidence is people are violating it at a higher rate than before. So we're going to increase the potential maximum fine from $500 to $1,000. But it's not really about the fine. Nobody wants the money. We want the compliance. We are serious. And again, if it's not about your life, you don't have the right to risk someone else's life. And you don't have the right, frankly, to take a healthcare staff and people who are literally putting their lives on the line and be cavalier or reckless with them. You just don't have the right. And we want to thank all of the people who are getting us through this every day under very tough circumstances. and we see the illness rate among these essential workers, and we know the sacrifice they're making, and we should respect it. It's that simple. You have the first responders who are out there, your police officers who are out there, the transit workers who have to drive a bus and the train every day, the healthcare workers who are just doing extraordinary work. So let's respect them and let's help them. We're also going to set up a fund run by the Department of Health to assist the healthcare workers with expenses, costs, child care, et cetera. I want to thank Blackstone for making the first contribution to that fund of $10 million to assist the first responders. I hope other individuals and corporations follow their lead. We're also very aware of the mental health aspect of this situation and the stress and the isolation that this has caused, and people are trying in their own way to grapple with what this means and what is the impact. How do you rationalize this situation? And the mental health aspect of it is very real. Headspace is going to partner with New York. They're an app. They're going to have content for New York and free membership for New York, so we thank them. But we also have an emotional support hotline. We have thousands of mental health professionals who have signed up to volunteer to provide mental health services, so we want people to make sure they know about that and it's available. I talk about perspective a lot, maybe frankly because partially I'm speaking to myself, and I had a good conversation with my daughters last night, Cara and Michaela, who are often wiser than I am and wiser than their years. It's very hard to see the number of deaths we're having. It's frightening, it's disturbing, that amount of loss. I'm the governor of New York. I see my job as preventing that kind of disturbance and negativity and loss for the people of the state. Perspective, you know, we like to think that we can control everything. We can't. We like to think that we can fix everything and fix all the problems for people. We can't. The undeniable truth here is that this virus is a deadly enemy, and we will lose, and we are losing people who are vulnerable to the virus. That can't be controlled. That can't be fixed. Why? That's Mother Nature. That's a question that God can only answer. But control what you can. Do what you can. The challenge is to make sure that we don't lose anyone who could have been saved if our healthcare system was operating fully. Don't lose anyone who you could save. That is a legitimate, ambitious goal of government. And that we have done so far. That we have done so far. Have we saved everyone? No. But have we lost anyone because we didn't have a bed, or we didn't have a ventilator, or we didn't have healthcare staff? No. The people we lost are the people we couldn't save. Not for lack of trying, and not for lack of doing everything that we could do as a society, not only as a government and as a healthcare system. So to the extent we can find peace in that, it helps me. And we are still New York tough, and New York tough means tough, but tough in a New York sense also means compassionate. It means that we are unified. It means that we are loving, because if you're really tough, the really tough guys, they're tough enough to show love, and because we're smart. And that's how we're going to get through this.